Uh, and also, please mute your mic during the presentation until asked. Also, we'll have a lot of discussion in a lot of the breakout rooms as well. So look forward to that as well. So next slide. All right, so as far as the agenda goes, today we have, again, a jam-packed agenda where we're going to start off with introductions, and following the introductions, we're going to have a MKE Elevate timeline and updates. Following that, we will have the community co-chair interest, which we all have. I have sent out a number of emails from our prior meeting, just disclosing some interest of the co-chair. So we'll go into that. The discussion of the name change for our overall goal as far as what we're doing within this action team. And then we're going to go over discussing the draft of the SMARTY goals, implementation partner agreements, and some breakout sessions. So look forward to that. We're going to discuss objectives, interventions, and implementation partners. And that's where most of our time is going to be. And then lastly, we'll do some event sharing. So our ultimate goal for the meeting is to have a consensus of the safety and violence prevention priorities, confirm strategies, and identify implementation partners. Next slide, please. Okay, now the best part, introductions. As we get to know each other, we would like to start with your name, organization, and role. The icebreaker question is, if there is, just thinking about the summer, if there is one word that you're looking forward to in the summer, what would that one word be? And we're actually, to be brief, you can unmute your lines, or you can also put it in the chat. But this is the time, so I'm gonna go first. My name is Robert Walker, and I'm a public health strategist for the City of Milwaukee Health Department. And one word I would say that I look forward to in the summer is fun. Yes, I want to make sure that it's fun and relaxing. Okay, who would like to go next?
I'll go next. Good morning. My name is Liz Hammer. I work for Havenwoods Neighborhood Partnership. I'm the organizer, and I guess my one word would be peace.
Awesome. Thank you so much, Liz. And if you could popcorn to the next person, and we'll continue the introductions.
Good morning. My name is Janine Hibbler. I am the executive director of Heart to Heart Compassionate Widows Circle. And I think my one word would be safe.
I can go next. My name is Alex Cohn, and I'm a public health strategist focusing on health equity at the health department. And one word is beach.
I'll go next. My name is Kim Lombard. I'm with Freighter Hospital in our trauma center, and my role is the injury prevention coordinator. And my summer word is outside.
I can go next. My name is Elizabeth Banks, and I'm a community organizer of Faith and Sound. And my one word is daylight.
I'll go next. My name is Ellie Freeman. I'm at Vivint Healthcare as an insurance specialist, and my word would be grounded.
And I can go next. I'm Kaminga Relly. I work at Children's Wisconsin in the perinatal neonatal outpatient clinics, and my word is warmth.
Good morning. My name is Patrice Robinson, and I am a co-chair of the Public Safety Committee of Garden Homes Neighborhood Association.
and my word is empowerment.
My name is Brittany Roberson. I'm a community engagement coordinator at Frederick Medical College of Wisconsin Health Network. My summer word has to be sun.
Hi, everyone.
Hello. Oh,
My name
go
is
ahead.
Amanda Weiler, and I'm the Health Portfolio Manager at United Way of Greater Milwaukee and Waukesha County. And my word would be warmth.
Hello, my name is Renee Lochi. I'm the Executive Director of UNCOM United Neighborhood Centers of Milwaukee. And my one word is family.
Hi, my name is Star DeLuca. I'm the Program Manager for UWM School of Continuing Education Human Services Department. And my one word would be warmth.
Hi, my name is Peggy Moore. Pardon me. I'm the PR chair for Narcotics Anonymous, and I would say my one word would be outreach. Kind of one word.
Good morning. My name is Betty Tilgarte. I work with the Fire and Police Commission. I'm a community outreach coordinator, and my one word will be kid friendly.
I can go. My name is Ferris Rizek. I'm the community health epidemiologist here at the City of Milwaukee Health Department. My one word would be fishing.
I'm Lindsay O'Connor. I also work for the Health Department in our Human Resources Department, and my one word is sun.
Hi, Courtney Geiger, City of Milwaukee Health Department, Public Health Strategist with a focus on substance misuse and overdose prevention. And my word would be happy.
Good morning, everybody. I'm Stephanie Harling, Director of Haven Woods Neighborhood Partnership, and my word, all of my words have been taken, so I'm going to go with relaxation.
I'm Annika, a public health strategist working with Robert and the team at the health department. My word is garden.
I think it looks like everyone else has gone. I am showing up as MHD Pi. I am Melissa Seidel, another strategist coworker with Robert at the Milwaukee Health Department. And my one word would be biking.
And I think, sorry, I joined late, but I think that we're supposed to give a summer word, but I'm Gina Wai from Milwaukee County Children, Youth and Family Services. I am the program supervisor for the Credible Messenger program, and my one word for summer is peace.
Awesome. Thank you all so much for participating. It seems like it's a variety of great people in the room. If there is anyone else, feel free to put your name and organization and role in the chat. And what's your summer word? Be great. All right, so we're going to go next into our MKE Elevate timeline. So we're currently in May, at the end of May, but we are just now having our action teams to review our draft and goals and identify implementation partners. And prior to that, we have the steering committee to review some of the drafts of the goals and finalizing the mission statement and the charter and shared language. So from our first quarter meeting that we had, and we drafted also some SMARTY goals and brainstormed and strategies in March and April. So just to give you a timeline, and for those that are new, MKE Elevate is our community health improvement plan for 2023 through 2028. And so our overall arch is the priority of racism and health equity. We have 3 priority action areas, which is built-in environment, maternal and child health, and also safety and violence prevention, which you all are part of today. So again, thank you for that, and we'll go to the next slide. Now, as far as the MKE Elevate updates, our leadership update, which some of you know, but we want to reiterate that Mayor Johnson has appointed Mike Titus as our new health commissioner. And so we're excited about that and the direction that he is taking us for the next coming of years. And so we look forward to his leadership. Now the next update is the suggestions from our steering committee after our first Q1 action team meeting, and some of the goals that we have drafted, with some suggestions that they offered was that they would add decrease reckless driving to a priority and using Milwaukee versus Milwaukeeans, because as Milwaukeeans, it may not include like the immigrants, and we want to be more inclusive and they're diverse. So then our last update is that the introduction of our new MKE Elevate co-chair, which is Quinn Taylor. He's with OVP. He's the community program coordinator, excuse me. So he is as far as on the new end of the co-chair, and we also have a community co-chair as well. So, and we will get to that. Next slide. And this is where we talk about that. So that is, so our community co-chair interests, for those that are interested, I have sent out prior emails with for anyone that would be interested in being a part of being the co-chair. And so we will be selecting our co-chair and voting in August. So anyone that is interested, this is the last call for any individuals that would like to be a part of the MKE Elevate and the co-chair. So we have the link here for you. So if you would like to select it and complete the form, it will be great, and we will look over the interest form, and we will decide in far as voting together on our next quarterly meeting, which will be in August. Next slide. All right, so this is, I know it's been a lot for me talking. I know we're going through this a little quickly, but this is the time that we can get some discussion from you all. So there has been some discussion from the team that we should look into some name change, because we have a diverse of groups and organizations in this this body, and so we want to make sure that it aligns with all those that are being a part of this action team. So some of the suggestion names was, of course, we have safety and violence prevention. The next one is mental health and community resiliency. The next one is mental and physical safety. And then lastly, safe and supportive communities. So if you have any input, this would be the time if you would like to discuss a little bit about the name change, and then we will have the question if in the evaluation that at the end of this action team meeting that you can really decide. But I just would like to have some discussion around do we want to keep the safety and violence prevention name, or would we like to to use any of these names?
I would vote for safe and supportive communities.
Second.
I would also vote for safe and supportive communities.
I believe that I would vote the same way.
I'm also in support of that one, safe and supportive communities.
Hey, Robert, could we do like a raise your hand if you support safe and supportive communities, and we can do a count?
Sure, Lindsay, let's do that. So for those that is interested in the safe and supportive communities, can you please raise your hand and we can give a count?
I don't know where that button is, so I'm just gonna verbally raise my hand if that's okay.
Yeah, sure, thank you.
So I think we've got at least 16, Robert.
Okay, great. So it looks like the majority likes the safe and supportive community. So we will have a confirmation once we go into our next action team meeting in August. All right, next slide. Thank you all for your add-ons and feedback. Okay, so now we will be going into our Smarty goals for our priorities, our subtopic priorities. So our goals were drafted using the discussion and online contributions from our February action team meeting. And so what Smarty goals is, for those that are interested, we do have a reference here for the link, but it is acronyms for strategic, measurable, achievable, realistic, time-bound, inclusive, and equitable. So we have a data matrix where informed by the MHD's data and evaluation team. Then we're going to discuss the language to come to a consensus. So one by one, we're going to have a discussion to come into a consensus around these goals. Next slide. Okay. All right, so the first Smarty goal draft it was around the interpersonal and intimate partner violence, which was drafted and wordsmithed to increase efforts at the individual, relationship, community, and societal levels to prevent sexual and domestic violence before it occurs. Now, the possible matrix for this would be domestic violence and firearm-related crimes, domestic violence and sexual assaults, and then some evidence-based policy suggestions would be crisis response team. Now, just I want to just put this out there. This is time for discussion as well. I mean, is anyone objective, or do we all agree with this, how we work, how it's draft, or is anyone in objective? Okay, so it looks like everyone is in agreement with how the first Smarty goal is drafted. So next slide. And feel free to, if you would like to raise your hand, if you have objections, or if you have any discussion around that Smarty goal. All right. So for the Smarty goal 2, we have for crime and neighborhood safety, we have wordsmithed that it would be increased sense of neighborhood safety. So the possible matrix, and again, these are all drafts, and it can be, some wording around it, or some, add-ons. But the possible matrix is firearms related violent crimes that is not part of DV, crime reported and charged by MPD, and the evidence-based policy suggestion would be restorative justice approach. Now, again, you are able to, is anyone in objection? Or have any
I just
feedback?
have a point to raise. This is Karen with the Office of Children's Mental Health. Increased sense, that's like a perception. So your metrics aren't lining up with that. I think for your metrics, you'd want increased neighborhood safety. It's just semantics, but again, at some point, I think you're going to really want to pay attention to the exact words you have and how you're going to measure them. And so if you're going to increase sense, you really need to be doing a survey of how people feel.
Thank you, Karen. Thank you for that. Any other thoughts or suggestions?
This is Kim with Freighter. Those are my same thoughts as well. It's almost like you want to do an individual assessment. We talk about sense and feelings. You're getting to a personal level. So I would agree with perhaps a survey measuring people's feelings.
Awesome. Thank you, Kim. Any other thoughts, feedbacks, objections? Okay. Looks like Benjamin has increased resident perception of neighborhood safety.
Can I jump in here too? I'm sorry, I got distracted. So if our metric, to Karen's point, even to drill it down further, our metrics are firearms related violent crimes that is not part of DV. So wouldn't our objective be to decrease, maybe this is too simple, maybe I'm oversimplifying this, to actually decrease the number of firearm related violent crimes? Wouldn't that be your objective if you're measuring that? Or am I drilling it down too specifically? Which if I am, I completely understand. It just seems like, how are you going to measure increased neighborhood safety? Like, are there other metrics like that you're going to be measuring besides firearms and related violent crimes? Or
I think to just piggyback on what Stephanie's saying, you need to decide what you like best. Do you like these metrics, or is that really the goal you want? Do you want to increase people's sense or perception of neighborhood safety? If that's what you want more, then you need to have a metric to measure it, and it's a perception survey. If you really like these metrics, and I think these metrics are great because you've got the data, then you need to rewrite your goal, and it would be about decreasing, and I gotta move something here, increasing neighborhood safety or decreasing violent or crimes or whatever. Do you get what we're both saying?
Absolutely. Absolutely. Thank you.
So
I just
I
have
would
to-
say though that these are pretty downstream metrics, and that keeping a goal that's broader in terms of perceptions of resident safety being kind of more normatively valuable maybe.
I think I have to push back on that a little bit, Benjamin, only because here's the thing, perceptions of neighborhood safety, no matter how successful you are in this initiative, people always land on the negative. They have a bias toward fear. And even when we have experienced, even when things are good, there is a forever perception that we're just teetering on the edge of disaster. So I don't know that I don't know that neighborhood perception safety is going to be a big indicator of the work that you do. So I would I would look more toward your goal to align with your hardcore metrics, because then you can make a case for the work that you're doing. But if you depend on the perception of residents, boy, that's a losing battle. Because you can present all kinds of data to them saying that they're okay, and they will not be okay. So just food for
So
thought on that.
I don't disagree at all. You know, I think it is a higher hill to climb. But when I think about, you know, generating true violence perception, like Ms. O'Connor said in the chat, that perception is really critical to assessing, you know, how we are shifting our, you know, mental models and therefore our systems towards, you know, conception of safety that gets away from the pervasive fear that you named and towards that, you know, interconnection. And so I think it just, for me, is more a matter of scope, you know, and how long away we want to look with these goals and, you know, kind of how
Right.
we want to aim.
Yeah, I agree with you, Benjamin. I think perception is really important, and it's what drives everything, the economy, the home ownership, all of it when you're building community. But I think that to use that as a measuring of your success right away for your shorter term goals, I don't think would be representative of the work that you put in. But I do think that that perception of neighborhood safety is important with regard to a community and economic development perspective in building the city.
Can I ask what the intended timeline for this goal was? Is it the 5 years of the chip?
Yes, it is for the 5 year of the chip. We want to really have concrete goal by June, and then we're going to hit the ground running once we actually as a collective decide on this goal.
So, you know, I think that Kim's very right. It really depends on what the metrics that are informing the perception of safety over that 5 years that we'd use, and how measurable or attainable you know, a step towards a perception of neighbor safety would be. I'm curious if Alexandria knows more about the data that she mentioned, right? You know, because a survey, if that survey is asking about, you know, have you had a exposure to a violent event in the last 3 months, or that's very different than, you know, what is your sense of the safety of your block kind of thing. And so I think it would, yeah, I'd just be curious to know how it would be measured if it's a reasonable goal over that time frame. But I agree with everything she said.
I was going to say for that metric, it was either Health Compass or data you can use that showed the results of that survey, or like whatever data source that they grabbed that from. So I'm not really sure like exactly what questions they were asked, but I don't think it would be hard to reach out to see kind of where exactly they grabbed that data from, or what survey in particularly, what questions. Oh, Ferris added it.
So the perception part is what Kim was talking about with increasing sense of neighborhood safety. ACS has really good metrics in regards to that. But I just wanted to ask Stephanie, I guess, a question. And I don't know if that's the statement you were trying to say. So you're saying that if we're reducing gun violence and all the metrics that we're pulling out from, then the sense for that population, for the neighborhood safety, they're not gonna have like an increased sense of neighborhood safety?
Well, I mean, it's bold of me to speak on behalf of a huge population. I just, based on my experience, all you need is, I mean, even if you decrease gun safety, and if someone has a shooting on their block, even with that decrease, it just takes a really long time to change people's minds about where they live and what's going on. So I don't want to belittle the need for people feeling good about their neighborhood and perception of safety. I think that's really important because it's what drives investment. But when you're looking at measuring your own work and in terms of, you know, being able to measure your own success and accountability, having such a broad goal of increased sense of neighborhood safety aligned with the metrics that you're putting down here, they just don't match. So to Karen's point, pick one or the other. Plan your metric to be a perception survey. I would not advocate for that. I like these metrics. I just would like to have them hardcore, more accountable goal, because increased sense of neighborhood safety along with these metrics seems really esoteric to me. Or create another slide, create another goal with another set of metrics that focuses around neighborhood safety and juxtapose it with this goal, and have both of those goals, because I think they're both important. They're just not aligning.
Got it. Thank you. Thank you all so much for this discussion. It's so rich. We have 3 more goals that we have to have some more discussion on, but I will send out a survey. And if you could please, in the evaluation survey, put your feedback there as well, and we will discuss more. Next slide.
Can I just say one thing on crime reported and charged by MPD? I don't believe MPD charges. It's the DA's office, so I don't know how distinct you need to be on that.
Okay, thanks.
You know what I'm saying?
Yeah, totally. Okay.
And the neighborhoods are becoming more and more aware that it's the court systems that are failing them, that they're being victimized by the courts and not by MPD or by whatever other partners we have. And to Stephanie's point, you can talk all about whatever guns you pull out of City Milwaukee or County Milwaukee. If it's not coming out of their street, they don't see it as a plus. Okay. Just wanted to give you my viewpoint.
Absolutely. Thank you so much. And I think Kim, did you have your hand up? I see your hand is also up. Did you have something that you would like to add really quick?
Well, I forgot to, but I think this is all very good conversation, and I agree.
Okay. All right. So thank you again. So the next SMARTY goal 3 is regarding the reckless driving and motor vehicle crashes. And we drafted the SMARTY goal of decrease risk factors for reckless driving. The possible matrix is fatalities reports by MPD and MFD. And then the evidence-based policy suggestion is advocacy for ordinance change. And you can, is there any objections or is there any thoughts around that SMARTY goal?
Well, this is Karen again, and I'm going to go right for the words. I think if you're talking about risk factors, you need to identify what the risk factors are, and then get a measurement that really speaks to those individual risk factors. Because right now, again, I'm not seeing an alignment between your goal and your metric.
I would agree. I think we're in the same boat as the last slide, you guys. Both metrics and goals are valuable. You just pick one or add another goal.
Yep, and these are all just drafts, so your feedback is appreciative, because then we can be able to come back and debrief on how we could better align with the goals and the matrix. So they're just drafts just to kind of give examples, but thank you so much for that.
And these are also not complete lists of metrics. We just kind of pulled a few to maybe highlight what's possible, but we do have access to more data. And if your own organization has access to data that you think would inform these goals, we would welcome that as well. So what you see on the slides is not the end all be all. It's just the launch point for discussion.
If I could also add, I think I would suggest maybe changing fatalities to maybe like critical injuries. I think that we're seeing that people are maybe making it due to medical support, but not necessarily then we're not counting for people who are getting critical or long time injuries. So maybe changing that a little bit to be inclusive of that.
I would also add, so if we're talking about risk factors, there's interpersonal risk factors, environmental risk factors. I think we should look at this maybe a few different ways. And then I also wonder if this would probably be an additional goal, but I feel like we deal with an issue of just cultural norms when it comes to reckless driving. So it'd really be interesting to find out what people's norms and views are, and choices, and kind of really dig deep a little bit to find out a little more about what the behavior is. And then maybe move to how do we change those norms? How do we change the culture? Yeah, those are just my thoughts.
Awesome.
This is Patrice. I strongly agree with what Kim just shared. But I also was thinking it's a possible matrix, not just the reports from MPD and MFD, but what about insurances? Because a lot of times the way those reports are submitted through the insurance and how the insurance investigates it as well, I think would be quite interesting to compare and see if there's a big contrast.
Awesome. This is again some great feedback. We definitely are taking them and documenting them as we continue to do this work. And we appreciate your input. Is there any other comments or objections? Okay, thank you. So next goal, next slide. All right, so for our Smarty goal 4, we for mental health, we wordsmithed the Smarty goal as improve availability and uptake of behavioral health resources for all Milwaukeeans, but we're going to change the Milwaukeeans to Milwaukee as we got suggestions from our steering committee. So the possible matrix is mental health provider rate in providers per 100,000 population. Then the evidence-based policy suggestion is mental health, behavioral health availability. Is there any thoughts or feedback or any objections?
Is it possible to add a metric? Because you're talking about just kind of general, how many providers do we have per 100,000 population? This is maybe data that we, due to HIPAA laws, but we can't get, but is there general data that we can get about how many, an uptick in the utilization of mental health amongst Milwaukee residents? Because we can have more providers, but if there is a stigma around mental health and getting that help, I don't know how helpful that would be. And And maybe even looking at who, I don't even know, but right now I've got to believe that there's a shortage of providers, and who has requested maybe through 211 mental health help and has yet to receive it. I think that's being able to shrink that gap and show that you've shrunk that gap would be powerful.
Another possible metric is the number of school-based mental health programs that you have in your schools. So the number of DPI grants funded. Because here's a fact: 75% of kids access mental health care in schools. And so that's a huge population of youth. I think, again, I'm going to say this is a big goal. And I think you're going to want to give some careful consideration to how you define resources. Because right now you're defining resources by the number of healthcare providers, but resources are online resources, apps, so on and so forth, 211, Badger, whatever that information sources. So a good goal, love it.
I think also, for me, in my experience, it's not just the providers are important, who and what's out there. However, it's the culture, because even though there are providers, if it's in my culture that I don't believe in and support my perception of mental health and participating in services and everything, I still may not reach out.
Awesome. Thank you. Thank you so much. We appreciate all of your feedbacks on this, because again, all of these goals are important, and we want to be intentional about how we want to be present in these spaces. So again, thank you, thank you, thank you. Now, lastly, the Smarty Goal 5 for substance misuse. We have the Smarty Goal of promote efforts at individual, community, societal level to increase harm reduction methods. And the possible matrix would be fatal and non-fatal overdose in the city of Milwaukee. And then the evidence-based policy suggestion would be adding mobile medication units. And again, we're looking for feedback. Is there any add-ons, any discussion around this that you all would or any objection?
Is your metric to reduce fatal and non-fatal overdose in the city of Milwaukee? Because it looks like you're just measuring how many fatal and non-fatal overdoses in Milwaukee. What is your metric there? Is it the reduction of, or just to, are you just counting how many?
Yes, to reduce fatal and non-fatal overdoses in the city of Milwaukee.
Okay.
Yeah.
Okay.
I have a question. As far as the metric goes, what about post-refusal overdoses? A lot of people will be attended to, and then they'll refuse any kind of treatment. Is that added into that metric that you're talking about, fatal and non-fatal overdoses? And how are you getting that information? Is it through Milwaukee Police Department, the fire department, hospitals? I mean, hospitals are going to be iffy because of the HIPAA stuff, but because that's what we do, is we're trying to reach out to post refusals to get them to understand more about the resources that are available, that there are programs that are absolutely free and they work. So I guess my question is it post refusal? Because that's where you're going to see the most influence right there, as far as the non-fatal.
I can answer that if that's helpful. So Peggy, I'm Courtney. I work for the City of Milwaukee Health Department, and I'm focusing on substance misuse and overdose prevention. We are a close partner with the Milwaukee Overdose Response Initiative. Not assuming everyone knows what that is. So essentially it's a program with the Milwaukee Fire Department that has community paramedicine training and a peer support specialist that does a within 24 to 48 hour response to any overdose, non-fatal overdoses that occur in the city of Milwaukee, and then any partnering cities that don't have an overdose response team. And so they go to that person's house and try to give them any resources. They'll give them a direct ride to treatment if they're interested. But really it is this program for that also includes folks that did refuse to go to the hospital after being reversed, their overdose being reversed. So the metric, the way that we're getting the data is through the fire department, the Milwaukee Fire Department for the non-fatals, and then the fatal data comes from Milwaukee County Medical Examiner's Office. But what you're saying is totally true. Like we are missing, that's such a perfect time to partner and to get people to be interested in treatment or resources, whatever that may be. It's a really great opportunity, but we have to be sensitive in what our expectations are of EMS. So the people that are actually responding to the overdoses, if folks are paying attention to the data at all, I mean, every day in just the city of Milwaukee, we have 5 to 7, 8 overdoses in a 24-hour period. And so it's really difficult to add additional expectations of the fire staff to to do anything additional. However, we are asking that they note any requests for harm reduction materials. We have they give out a Maury card that says if you're interested, you can contact Maury, and then we also have the actual response to a person's residence if they have a non-fatal overdose, but that doesn't necessarily mean that they'll be at that address that was given at the time of the overdose. We do have repeat cases of overdoses that we are trying to track. There's a lot of programs and initiatives that are in the works with the health department, or actually I would just say like the city of Milwaukee, but until they're solidified, it's hard to share what's going to be approved. But we are trying to pay attention to the data. We want to do a surveillance of overdose spikes. There's a lot of missed opportunities right now.
Awesome. Thank you so much for jumping in, Courtney. So we will really go into depth around the matrix and how the wording will be with your feedbacks and input. And feel free to put it on the survey as well as we send it out with a follow-up email that I will send out, so we could really, like I said, be intentional about how we are be impacting with these goals. Next slide. Okay, so MKE implementation partner. So what does this mean? Being an implementation partner for MKE Elevate means your organization has agreed to collaborate with us to support the implementation and the plans of the strategies, initiatives aimed to improve the health and well-being of our community. What does this collaboration looks like? Provide expertise, resources, data sharing, as it relates to the goals and strategy identified for this CHIP. Next slide. Right, so to continue, what you are agreeing to is sharing program data with us on a yearly basis. This may include data you regularly report on your grant funding. Things to note: if your organization does not have an established data reporting process, our MHD data team is willing to work with you to identify a meaningful matrix for this partnership, and data should not include client identifiers. And then also we will agree to attend at least half of the action team meetings, 2 meetings, and general meeting, which is will be 1 meeting, and I'll give you the information on that. A commitment to being an anti-racist organization. For more information, you can go to the link here that is on your screen. And then also you agree to implement 1 or more of the MKE Elevate strategies. Next slide. All right, so this is where you can select the link to complete the implementation partner agreement. I will also be sending it again in a follow-up email, but if you would like, you have the moment here to click on the link and fill out that form. All right, next slide, thank you. Now we're gonna go to the breakout rooms. So we're gonna have, everyone will be broken out into 5 groups. There will be a facilitator that will walk you through each goal. Everyone will review and brainstorm each category, and we'll roughly around 7 to 8 minutes. And then after the 8 minutes, we'll come back and then we'll disperse you to another goal to do some brainstorming for that as well, because we want to get input from everyone regarding these. Even if you do not have specific programs or expertise in this area, we just want to have that discussion and networking and dialogue. So so we are going to go into those breakout rooms. I'll leave it to Alex to disperse that, or Annika.
Going to open up the breakout groups now. You will go into which breakout group that you would like to go into. And then after that, when we come back into the larger room, I then will be putting people into different groups. So right now it's self-select. When you guys come in, I will be assigning them. So to make sure that everyone's able to kind of touch upon each topic. So I'm going to open up all rooms. And if you are having difficulties going to that room that you would like, I can also put you there. So the rooms are all open. You can join. And then again, if anybody is having troubles navigating or getting put into a room, I'll be more than happy to do that.
I'm not in the room.
Let me see. Is that Elizabeth?
Yes.
What group would you like to go to?
It doesn't matter. I mean, that can go to anyone in the
Okay.
beginning.
I am going to put you in interpersonal violence. And then Liz and Aaron, do you guys know what rooms you would like to go into?
Crime and safety for me.
Okay. And then Aaron, would you let know what group you would like to go into?
I'm not in any group now.
Yep, so sorry for the confusion. So we're just gonna bring the group back together and we're just gonna have a discussion from your first group, what you all came about of that. And then we're going to, then we're going to continue on with the presentation.
Robert, did you want the goal 1 group to go first?
Yes, yes.
Okay, so I can share since I was with that group. So just 1 second. We talked about Sojourner as a really important implementation partner. So hopefully we can find connections to somebody working at Sojourner. In terms of culturally responsive approaches to addressing sexual and domestic violence, we talked about adding the Muslim Women's Coalition, Diverse and Resilient, Milwaukee LGBT Center, the Milwaukee Women's Center, Community Advocates. Those came up as some of the primary implementation partners. In terms of additional strategies, we talked about how Fredert is the only level 1 trauma center, and so they would be providing medical response after an assault. And then we're curious if Aurora is the main organization that would have the sexual assault nurse examiner program. So if anybody has information on that, would love to follow up. There was also mention of a movie screening to raise awareness about sexual and domestic violence. So that could be another potential strategy. So those were the main items that we discussed.
Awesome. Thank you, Annika. Would there anyone else that would like to add? If not, we'll go to group 2. Okay. The facilitator that did the group 2 discussion, could you just elaborate a little bit about your discussion regarding objectives, strategies, and implementation partners?
Yeah, just because of the time restraints, we couldn't really finish everything.
Okay.
So for the first one, increasing the funds for youth supported involved in crime activities. You know, we had like a mix of suggestions, but basically the end goal is to provide the youth population for resources in the community to decrease basically like the crime activities that's happening across the city. So, you know, everybody agreed to that. Some of the implementation partners would be like Journey House, Milwaukee County Parks, MPS Recs, Running Rebels, City Year. And then we started going into increasing access to care. Obviously, the strategies there that are aligned is everybody agreed. And then, you know, that's when the time cut. So we couldn't finish the other ones.
Okay, no problem. Thank you for sharing. Goal 3, the facilitator for goal 3, could you give us just a brief summary of what you all discussed?
Yeah, so goal 3 is the reckless driving related one, and I only had the opportunity to chat with a small handful of folks. It's something that's outside of a lot of people in this group's wheelhouse, although we all experience it. So there was conversation around things like narrowing streets, taking away lanes. But when you leave all that extra road space, it just creates more empty space for people to drive recklessly. Things like the bump outs can work for the short term, but once people get used to them and adapt to them, you know, they remember which block those bump outs are on, and then they drive recklessly everywhere else. Things like that, noting how an isolated intervention isn't going to solve the broader problem. And then how reckless driving is tied with other neighborhood safety issues. So smaller issues turn into bigger issues. If we don't stop folks, you know, down the kind of low stakes line of things, their behavior could escalate. You know, I can run one stoplight, I can make a reckless left turn through a red light. I can just run all the red lights. I can, behavior can build in that way. And then in the next group, we talked about a lot around driver's education. So making sure it's required, making sure there is funding for providing that at low cost, ideally within the schools.
Awesome. Thank you so much. And I had the goal with the group for the mental health awareness to improve availability and uptake of behavior health and resources. So we talked a little bit more about having care plans, family support. We didn't come across any implementation partners just yet. And some other conversation was around workforce mental health support. So just bringing more of the businesses into the business community into that space as well. Then we also discussed about student-led mental health programs. And a couple of implementation partners was Source of Strength and the Office of Mental Health office. That was all for goal 4. Could the group for goal 5 go?
Hey, I can share some information. In a moment. I don't know where the thing went. Oh, here we go. So do you want us to just share the strategies or what makes the most sense?
Just you can just share what some of the conversation was around the topic.
Okay, for substance misuse, we clarified what substance we were talking about. So substance misuse could be alcohol, tobacco, vaping, illegal drugs, etc. So we assumed that we were talking about opioids, whether that's legal and illegal opioids. We talked about relevant partners in the community. So looking at like MAT, medication assisted treatment, different things that the health department is doing. We talked about the Good Samaritan law and the data that we collect and analyze from the fire department, from Milwaukee Fire Department and the medical examiner's office to help strategize goals.
Awesome. Thank you so much. We definitely appreciate everyone's feedback and we will follow up with you all regarding some of the objectives, strategies, and implementation partners. Can we go to the next slide? With the brief moments that we have, next steps, we have a general member meeting. It is the MKE Elevate Community Meeting, June 22nd from 4 to 3 p.m. at Washington Park Library. It will be free food, peach pops, mocktails, and community building. So feel free to use the information here to register. And then you can also, we also have the evaluation survey that will be coming with a follow-up email. So please, with all the feedbacks that you provided for all the discussions, we would like to hear from you through that survey. So please complete that. And there's a link there and I will be sending out. And for all those that are participating, community members can be compensated with a $50 Visa gift card for those that are not being paid during this time of attending this meeting. And so more information will be in the follow-up email. So that will be going out early next week. So next slide. All right, so we can share community events. I'm going to park this one. We can share community events through the website that we have, or you can send them by email and I'll disperse them. But if you do quickly want to share your events, you can put it in the chat. And I will leave it open until everyone has shared, but we will continue to share events through email. And next slide. Thank you, thank you, thank you. Our next meeting will be August 22nd, 2023. We have a register link that you could click on and register currently. And for the Q3, you can also reach out to myself or the co-chair Quinn Taylor, which our emails is on the slide. You can also email MKE Elevate at milwaukee.gov. And for more information, you can look at our website at www.milwaukee.gov/elevate and follow us on our social media at MKE Elevate. And so that is my last slide. Thank you so much to those that stuck around. I appreciate you. Feel free to reach out to me if you do come across any questions.